Dr. Heather Moore, owner of Total Performance Physical Therapy. Welcome to video 3 of our knee pain course. We're going to go through some things today on how to treat your knee pain, once you figure out the cause, and some things you can do at home to start working on it. Usually I say, the rule is 2 weeks. If it doesn't get better within 2 weeks, you're going to need to seek some medical attention. You should see a sharp decrease in pain with doing this if these are going to work pretty much right away. And the other thing is that if you are experiencing more pain while you're doing anything of these at home, you need to get in and see your healthcare professional, physical therapist, in order to be able to more accurately diagnose exactly what's going on. So thank you for joining me for the third part in this series. Kudos to you for sticking it out this long and, kind of really taking an interest in seeing what's going on with you. So, if you've done video 1, you've done video 2, you're a little confused, not sure what's going on, want to talk to me further, just hit reply to this email. Let me know your story, share your story, and we can kind of help you out a little bit better. I know people get frustrated and confused because there's no pretty box that this fits in, and a lot of times, especially at the knee, like you learned in the first video, it's the hub of everything going on. So it's really, we got to look at your foot, we got to look at your ankle, we got to look at your hip, we got to look at your back in order to figure out exactly what's going on at the knee. So if you haven't diagnosed yourself or you haven't figured out what's going on and you don't fit in a pretty little box that we talked about, it's okay. Not many people do. Another thing that I get asked a lot about is heat and ice and anti-inflammatory. So we're going to go over heat and ice real quick. What do I do? Do I heat or do I ice it? It really doesn't matter. You're not going to mess anything up. The general rule is if you fall, if you are, you take a tumble down the steps, you bang your knee, you get severe pain, get ice on it right away. All right? You don't want to put heat on in those situations. Usually for the first week after that traumatic injury, you want to put on, that ice or just the ice. After that, you can put on heat. If you've had knee pain that has gone on for 3, 4, 5, 6 months, you can use heat or ice. The only thing to heat, make sure you have it in a microwavable pack. You threw rice in a tube sock, something along those lines. Something that cools down. Do not use a heating pad that plugs into the wall. It's far too dangerous if you fall asleep with it on, something along those lines. So that's the heat and ice kind of conversation. And then the anti-inflammatories. A lot of people rely on Advil, especially with knee pain, to kind of get them through. Advil, you have really a 2-week limit. It's not safe after that. You can begin to wear away the lining of your stomach. And I know everybody knows somebody who's taken Advil for 40 years and has never had any problems. So I get it. There are exceptions to this rule, but 2 weeks is it. Every day for 2 weeks, that's all you should be taking Advil. If it's hurting you to the point where you need some sort of medication, you need to be seeking treatment. It is not okay to continue to take Advil. It is not okay to continue to think that your lining in your stomach is going to be okay. It's happened. It happens all the time in here. Unfortunately, by the time we hear about it, it's already too late. So just kind of an FYI on anti-inflammatories. I know they're over the counter, but you really have to be careful with them. So that being said, we can get into our knee pain treatment series. Now, this is a little bit different and a little bit more involved because, like I said, again, in this video and in the first and second videos, the knee pain is the hub of everything going on. So in order to treat the knee, we've got to treat above and below in order for this to heal itself or begin to take care of itself. A lot of people use knee sleeves or compression or a little band. My answer to that is great. It's not going to solve anything, and it can actually make things a little bit worse. So I know, again, people know somebody who has a little knee band and they run with them and they never had pain again. Doesn't help the situation, okay? And sometimes it can actually hurt the situation. So if you're relying on a brace or a compression, in order to have you be pain-free. It's a great temporary fix. It's not going to last forever. And then instead of, you know, being able to get it resolved quickly, it's going to take a little bit longer. So just be aware of that fact when you're looking at if a knee brace or a sleeve is appropriate for you. Generally, my answer is no. Other than maybe a first couple weeks or two to put some ice in it and put it on, but beyond that, no. Okay. So the first one we're going to do is hip hike. So when we went through our last video, we talked about weakness, you know, and when we talked about patellofemoral issues, part of that is the tracking that we talked about. The kneecap doesn't track correctly up and down. That's a lot of times due to weakness, all right? Not a lot of times, all the time due to weakness. One muscle pulling stronger than the other. One of the big muscles that is a culprit in a lot of hip pain, knee pain, ankle pain, foot pain is the glute medius. So we're going to do an exercise today, specifically to fire the glute medius. So you're going to stand just on any surface, and all you're going to do is put your hands on your hips and hike your hip up, okay? Now, it's not your knee moving up and down. A lot of people make that mistake. Your knee is going to stay in the same exact spot it did and just go up and down nice and slow, okay? It's a hip hike, okay? It looks easy. It's very difficult for people because a lot of times they just want to do this, which is a march, and that's not correct, or they just want to do this, which is a bend in the other knee. Everything stays stationary except for the hip. You want to drop it down and bring it back up. Now, if you're really good, you can do this on a step. You want to do about 30 of those 3 times on each side. Just making sure you're dropping down and coming back up, and dropping down and coming back up. You're going to feel it in the leg that's standing. You might feel it on the other leg, but you're really going to feel it on that leg that's standing. If it starts to hurt, stop. Otherwise, this is an exercise that's safe to do every day. And you're going to start to see some changes even in your feet, all the way up to your hip with this one. Now, the next one we're going to go over is actually the single leg stand. We're going to do foam rolling last. So the single leg stand, again, if you have a meniscus injury, if you have patellofemoral issues, or just regular knee pain and weakness, a lot of times people have no idea how poor their balance is. And when your balance is poor, that means that your ligaments are not working correctly all the time. Your meniscus has to work a little harder, your muscle has to work a little harder. So balance is really important to train, and it's not inherent. So people always say, oh, my parents had bad balance, or my mom falls a lot, so I probably have bad balance. It has nothing to do with your hereditary principles. It has everything to do with did you practice balance. It's not something that comes naturally. So when you're talking about balance, it's really easy, and you can do this while you're standing there like chopping vegetables. So you want to stand on one leg, and you want to hold this for 30 seconds. Now if you can do that, you're going to want to go ahead and close your eyes and do the same thing, holding it for 30 seconds. A lot of people are surprised when you go and close your eyes how quickly they are to fall. If you are quick to fall, that means there's some issues there, and you want to make sure that you work your way up to holding that for 30 seconds. Now, if you do that with your eyes closed and you're holding for 30 seconds, put a pillow underneath your foot. Okay, same thing. Close your eyes, hold it. 30 seconds is the goal. All right, you always want to practice balance on both sides. All right, and if you wind up getting more pain, again, go ahead and stop that exercise. I would do it near a counter or something just to start, just so you have that balance there. That will help. When the last thing we're going to talk about is foam rolling. Foam rolling is really, really important when you're treating knee pain, hip pain, back pain. It really is not only a treatment tool, but also a diagnostic tool. Now, in our clinic, we use what we call our spike rollers, okay? They are aggressive, and they are going to get everything out that they need to get out. When you're dealing with a spike roller, you want to, this is aggressive. So I usually recommend people have 2 foam rollers. I have 2 at my house, and I usually recommend people having 2. You have spike, and you have a flat roller, okay? Flat rollers, they sell at Dick's and, Walmart and things like that. Not many people sell this one because this can leave bruises and can be pretty aggressive. But you want to make sure that you have both, because if you can't tolerate foam rolling on this, you want to foam roll on a flat roller. This is the gold standard. This is what you want to work up to. But if you can't tolerate it, you want to start with a flat roller. Every day you should be foam rolling. Whether you're working out, whether you're not, you want to get on a foam roller every single day, okay? And why I say it's a good diagnostic tool also is if you get on this foam roller and you start to feel pain, or there's pain points, and you're like, I didn't have any pain or issues in my calf, but man, this is killing me. It's showing you something that's about ready to break, okay? So if you get on this and you roll out and you're rolling on your hip or you're rolling on your, your back, and you're like, my gosh, there's a lot of pain here, but you don't feel pain when you're moving around, or you've never felt pain there before, you're getting ready to, all right? So this is always a good diagnostic tool. Allows you to see kind of where you need to be, or where you need to work on. This is its little evil partner, and this is what I recommend having when you really want to get in. This has a little bit more firm spikes and is concentrated. Obviously, you don't have time to roll out your entire body using a small ball. People use at home lacrosse balls, beach balls, things like that. This is the preferred method only because it has spike balls on it. So it's got spikes in it. It'll absolutely go into that muscle and chew it up. So places like your hamstring, your glutes, your calf, after you roll out on this and you're like, felt great, hit it with this, okay? Or if you roll out on this and you feel some deep spots that this doesn't get to, this one will. So, using a combination of the two, foam rolling can be done at anytime throughout the day. And the best part about foam rolling is you don't have to do it all at one chunk. So I recommend foam rolling 10 minutes a day. If you can't do it 10 minutes, do a minute here, roll out your glutes, do a minute there, roll out your calves, do a minute there, roll out your quadriceps. Do different things that make, that make up that 1 minute, and then move on. Or if you have 30 seconds. Now here's the question I often get asked is, do you stretch, do you foam roll? Stretching has its place. And I know people a lot of times, especially with knee injuries or back injuries, will blame not stretching on the reason they have the injury. That has nothing to do with it. That really has not been proven to have anything to do with it. If you're going somewhere and you're seeing someone and all they're doing is stretching your hamstring, they're not doing you a service, Or if you go and you work out with a trainer and they jam your hamstring up over your head, it doesn't matter. Like that's not helping you and actually probably tearing some of your hamstring muscles. So you want to be aware of that. While stretching does have its benefits, if you're choosing between foam rolling and stretching, foam rolling every day, hands down, okay? If you have a lot of time and you want to stretch, then stretch. Stretching is, we can get into more of that later on. Some of our other YouTube videos that we have, we go over dynamic stretching, which is the preferred method. But just to kind of put that argument to rest, if you are going to pick between foam rolling and stretching, foam rolling is the way to go, okay? Stretching, really is not preferred. So when you foam roll, I'm going to show you just a couple techniques, especially that are going to affect your knee. Now, if you've never foam rolled before, the technique we're going to do first is going to be really hard if you have a spike roller. So we're going to do the IT band, which is coming down here, which is really popular for IT band tendonitis. The easy way to do it, and this is not easy by any means, but you're going to start with the top leg crossed in front and the bottom leg jutting out, okay? For the foam roller, you're going to start all the way up at the hip, and you're going to go down to your knee, okay? So you're going to want to roll, and I'm just going to start down at my knee, and go up to your hip, okay? If you find a sore spot, stay on it 20 to 30 seconds, and then move on. The more you push up on your hands, and the more you push up on the leg in front, the more pressure that's going to come off your IT band, okay? As you get really good and this is less sore, you can stack your feet and do this. But until that happens, you can drop this foot, push up on your hands, and take the pressure off the IT band. This will hurt a lot if this is the first time you're doing this. So again, don't hesitate to go ahead and use a flat foam roller to do this. But if this is unbearable, that's signs of a significant issue going on in your IT band. One that even if you don't have knee pain per se, you don't want to ignore. So really start to incorporate foam rolling into your workout every day, regardless of what you've been diagnosed with. Foam rolling is really going to help. And we have other YouTube videos on our channel that shows you how to foam roll the whole body and different parts of the legs and things like that. So thanks again for watching. That concludes our video series for the knee. Since you stuck it out with me and watched it, we're going to go ahead and offer you a free in-person consultation. So you can click the link below and come to one of our facilities and make an appointment and have a 20-minute one-on-one in-person consultation, free consultation with one of our therapists, one of our knee specialists, that will let you know what's going on, kind of the causes, and how to treat it. Once again, thank you for watching, and hope to see you soon.